Healthcare workers at local hospitals fear for their lives. It's challenging times for this fraternity. They are fighting a pandemic but are not sufficiently armed. They are now prone to the virus. Moreover, one of the doctors has tested positive.
At this moment, we don't have much. For some reason, the community wears the N95s and the surgical masks, but it's very difficult for us as doctors to get this in the wards. We have so little D-germ left, that is the alcohol we use to wash our hands, that we lock it up or we carry it with us, because otherwise we won't have. We also don't have masks. Every time when I ask for a mask, they are told to me we have no masks. Until I go to the storerooms and get the key for the storeroom, then they will be given a mask to me. But otherwise, the personnel there are not keen to give me masks, us as doctors.
And there appears to be good reasons to be concerned. A study of 138 patients hospitalized with COVID-19 in Wuhan, China, showed that 29% were health professionals. Another doctor from a local hospital, who also asked to remain anonymous, says he fears for his life.
Go to work, I fear not only my patients' lives, but I fear for myself and the fact that I directly put my loved ones at risk when I come home every day. Before the novel virus reached our shores, I knew we were not prepared then, nor are we now. With the current lack of even the most basic personal protective gear, such as face masks, gloves, and hand sanitizers, how will we even be provided with the more advanced gear such as the hazmat suits that we are supposed to wear according to the guidelines stated by our own health department when they have failed to provide that to us? Aside from the mere fact that we do not have the gear to protect us, how are we supposed to protect ourselves when the hospital does not disclose information to its own staff of local transmission of COVID-19 amongst its staff?
Livingston Hospital in Port Elizabeth has been identified as one of the quarantine hospitals. But on Friday, workers downed tools, saying they had not been provided with adequate protective equipment. These include technicians, artisans, general workers, cooks and laundry staff. The health department says adequate and sufficient protective gear will be provided.
Instructed all hospitals, and I'm sending up a circular to this effect, that every person who works in a hospital, whether it's in a patient or in the laundry or is in a garden or is in the kitchen, must actually be provided with a mask. Now, most staff that actually work in many of these areas, they already have the masks. But we just want to make sure now it's a standard offer to everyone. The masks are important because it helps them to make sure that no one transmits the infection.
The Eastern Cape currently has 25 positive cases, the majority of whom are from Port Elizabeth. The doctor's greatest fear is the possible closure of the hospital due to widespread exposure. Lerato Fekisi, SABC News, Port Elizabeth.